everybody. I am Sanya, your host from today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today we are going to discuss about a skin healthy with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch immensely and it may trigger certain medications, insect stings, sunlight, and sometimes the cause is unknown as well. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age group as well. Urticaria is classified as acute and chronic. But the most important part is not to ignore, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early emission. In today's digital world, it's a boon or a blessing if we can get to hear from an expert dermatologist online about urticaria, its type, how can we prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, today we have with us a renowned dermatologist of India, Dr. Leena Ravindra. I would tell you that she is a renowned dermatologist, professor, and currently working at Prithvi Children and Skin Clinic at Vijayanagar, Bangalore. She has a wide experience of many years in this field. A very warm welcome to you, Dr. Leena Ravindra, and it's a pleasure to have you today as we are going to discuss a very important topic that is urticaria.
Thank you. Yeah, tell me, like what exactly do you want to
Doctor,
know?
my very first question to you is that what is basically urticaria? How we can define urticaria?
Urticaria is basically a acute hypersensitivity syndrome, wherein there is edema. Edema, that means that is, in common man's terms, I could tell it as the fluid collection within the dermis. It happens because of histamine release. So, and it is seen as hives. Hives meaning they are red, raised rashes which are there, which are basically the main feature of urticaria is that it's transient. The lesions are there for some time and then they disappear and they come back at another area. So it can be acute or it can be chronic. And the main symptom is itching. Yeah.
Okay, so the main symptom is itching, and as you have mentioned that it can be acute and it can be chronic. These are
Chronic.
the types
Yes.
of urticaria.
Yes.
Okay, okay, doctor. And doctor, what are the main causes of urticaria? Why urticaria occur in body?
Urticaria, it is actually what I usually explain it so that the patients suffering understand is that there's something which is not going right in the body. It can be because of an infection, it can be because of an allergy, or it can be sometimes autoimmune also. Autoimmune is when our body produces antibodies against our own cells. So something is not going right. The mast cells, these are the cells which are there in the blood. Okay, they get activated. When they get activated, the histamine is released. When that is released, it spreads through blood to all parts of the body, and there is development of hives. So the cause can be because of many things. It can be just like the common thing when a person comes with acute symptoms, like he has had urticaria lesions for a few days. The common things that we ask is about the food or the drugs, or sometimes some things that they have touched also can cause urticaria.
These are the causes, different causes, and
Yes,
you have
different
mentioned that
causes. Yes.
food can be the very main cause.
Yeah, but food is when there are acute symptoms, food is one thing that we consider. The first thing that we suspect is the food. And second thing is that it can be because of some infection anywhere in the body. It can be just be a common cough and cold also, which can cause the simple urinary tract infection can cause, otherwise a dental caries or sinusitis. Any sort of an infection in the body can trigger urticaria.
Okay. And doctor, how a person can identify that this particular thing is urticaria, and he or she needs to rush to a nearby dermatologist?
Urticaria, as such, you get the very characteristic feature of urticaria is that the lesions are transient. That means they appear at one place. They stay maybe sometimes for 10 minutes, sometimes for half an hour, but they disappear from that area and later on appear at another area. And there will be intense itching. Uh, Sometimes it becomes very severe when it is associated with something called as angioedema. That is, this sort of like I told you, there is edema in the skin which happens when there is urticaria. So it can happen in the throat also. There can be swelling. So that can cause difficulty in breathing, swelling of the body. This is angioedema. This is when you have to definitely rush to get treatment. Otherwise, simple urticaria sometimes resolves on its own also. But definitely, unless you know that it is urticaria, don't treat it by yourself. Take the advice from somebody qualified, and you should go ahead with the treatment.
Okay, okay, doctor. Very well explained. That means if someone is having urticaria, it can be worsen if they are not treating it well or doing self-medication.
Yeah, self-medication is definitely not advised because it can some common medications also can cause urticaria. We need to identify what it is exactly, and then only go ahead and treat it.
Okay, okay, doctor. And doctor, as you told that sometimes urticaria can also affect the inner body as well. So is urticaria serious?
Not inner body. It can affect the throat. Like it can cause breathing difficulty. So your throat can swell up, and then there's difficulty taking a breath. So that is a emergency. But and you can have swelling on the body because of the edema itself. There can be swelling of your hands, feet, face. That sort of thing can happen.
Okay. And doctor, is urticaria contagious? If someone is having urticaria and
Um,
he or she, wears someone's clothes or get in
no,
touch,
no,
so is
no.
urticaria contagious?
No, no, definitely not. It is not an infectious condition. It is a reaction of your body to something. As I told you, it's reaction of your body to something which is the body doesn't feel is right. So it doesn't spread like that. Definitely not contagious.
Okay. So in any case, if someone is, someone's friend is having urticaria, that doesn't mean that it will come to them. So don't treat them
No.
like, a different.
Yeah, 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 definitely.
So, okay, okay, ma'am. And doctor, when we are talking about the causes, what is basically urticaria? What are the major symptoms of urticaria?
As I explained, these are wheals. Wheals or hives, they are called as. They are blotchy red rashes which appear, and it can appear like how you can identify it as it's like something when something bites you. There is a red rash that appears. That's the sort of a rash that you get when you get urticaria, and they are transient. Transient meaning they stay for few minutes to sometimes few hours, and then they go away. And sometimes there can be swelling associated.
Okay, so they come and go. That's the
Yes,
main
that is the
thing.
main thing. They come and go. At one area, sometimes we try to elicit the history from the patient. They're definitely not because it's always there. It's there continuously. If it goes off in one area, it comes at another area, and the whole span it keeps on continuing again and again. The rashes keep on coming. That happens, but you have to concentrate on the lesion. If there is some rash on the hand, whether that rash is there even after half an hour or does it go away completely without leaving behind any marks or anything like that. So that is one thing that sets it apart. Like this is a very transient condition. There's no mark or anything when the rash disappears.
These are the major symptoms, and as you have already mentioned, that itching is also,
Itching is
happening.
the main symptom. Some people can get just itching. The wheals may not be that visible. It is itching is quite this is one of the itchiest conditions I can tell.
Okay, and the person who have urticaria, might have a lot of problem because itching itself is very,
Yeah,
bad symptom. Continuously
Yes, yes.
itching uh,
Yeah.
is also so bad. And doctors, sometimes you might have come across some patient who have self-medicate their urticaria, by applying some kind of home remedies, or somebody suggested, some of their friends or family members suggested that, apply this particular cream or this particular thing, and the urticaria can get good. What is your advice to the people who self-medicate themselves?
Thing is, urticaria is something like no amount of application of anything is going to make it go away. When we treat, also we try to treat the symptoms. Symptoms in the sense we try to reduce itching, reduce the rashes from appearing. But self-medication, like it might more than anything, it may not work. And if you have to apply anything on your own, you should use something very bland. That means you can use a moisturizer just to soothe the skin so that the itching is reduced, or use something like calamine lotion. These are safe things that you can use on your own for any sort of a rash, just to get the symptoms down, just to get the itching down. More than that, please don't do anything, because you're going to make things worse. And sometimes, not especially in urticaria, in some of the skin conditions, when patients self medicate and when they come to the doctor, what happens is the rashes don't appear as they have to appear. And we are not looking at the main illness at all. We are trying to treat the rash which has happened because of the medication. We are not actually treating the cause at all. So please don't self-medicate with, especially over-the-counter creams contain most of the, like many of my patients, when they come to me, they tell that I went to this pharmacist and they gave me this cream to apply. They feel that creams don't do any harm. It is not so. So creams are also medicines. They have to be treated like medicines and applied like medicines. Please don't self-medicate.
Okay, so a big no to self-medication from
Yes,
Dr. Leena, that
yes,
do not
yes.
self-medicate in any case. And doctor, moving on, knowing more about urticaria, as you have mentioned that there are two types of urticaria, that is acute and
Uh,
chronic. So what is basically
it
acute
is
and
it is
chronic?
basically, the thing is, acute is when the symptoms are present for approximately 6 weeks duration. If it is less than 6 weeks, we call it as acute. If it has gone beyond 6 weeks, it is chronic urticaria. So this is how we, and the treatment slightly differs depending on whether it's acute or chronic.
Okay, okay, doctor. And doctor, what are chronic urticaria hives? How will they go away if they have to be treated differently, or are there any other medications for chronic
See,
urticaria?
for any sort of an urticaria, the key is to find out why the patient has got the urticaria, why the rashes have come, why the hives have appeared. So we'll have to look for the cause. When you know the cause, you eliminate the cause, and urticaria is resolved. Until and unless you know why you are getting the rash, it can go away at this point of time. But again, if you're allergic to a particular, if it is because of food, one particular food item which would have caused it, if you consume the food again, you'll get it again. So main thing is to know the cause, whether it be acute or chronic. We'll have to know the cause and eliminate the cause so that the urticaria resolves. In chronic urticaria, how the treatment differs is like, um, after, when it is acute, it is easy to find out the cause. You know what is different, like what when we ask about the food, we try to ask like, what is something new that you consumed in the past 24 hours to 48 hours. Okay, but when it is chronic, it's been there for a long time, it's very difficult to pinpoint and tell what it could be because of. Then maybe it might not be the food, it can be some infection somewhere, or sometimes it can be autoimmune. So if it is so, then we'll have to investigate and we'll have to find out the cause, and then try to treat it. Sometimes some of these urticarial lesions, they don't go off. It goes on and on and on. Then we'll have to treat it differently.
Okay. And doctor, what are the do's and don'ts? As you mentioned that urticaria can also be caused by food. So are there any dietary precautions for the people? Any do's and don'ts that they should not
Uh,
eat some particular type of food, or should not?
it, it's very difficult to tell who gets allergy to which food items. If I have urticaria, I may be getting it because of dry fruits or nuts or something like that. but another person can be getting it because of some other food items. So you will have to check in your diet what could be the cause. It's very difficult to pinpoint and tell that these foods are bad. These foods should not be consumed when you have urticaria. It's not like that. It is very individual. Like it can be okay to some people, it may not be okay to some other people. So there's not definitely what they should not do is don't scratch. You go on scratching and you're going to increase the itching again increases. When you scratch, the itching again increases. And you're going to make uh, the marks on the skin. That is what will go on for a long time. So don't scratch. Use soothing agents like calamine lotion or moisturizing creams. That would be good. Other than that, no other thing should be applied.
Right, and as you have mentioned, itching, sometimes people scratch it because of the itching. Is it like that the itching or the hives or urticaria get worse at night?
There's nothing like that. There's no diurnal variation like that or seasonal variation. No, no, it can appear at any point of time. If not related to seasons or with the time. No.
Okay, so they are not related to any kind of season or any day and night. It just appears and then disappear, as you mentioned that sometimes
Mm-hmm.
itching can be at one part and the other part at the time it will be okay. So
Yeah.
that's the urticaria effect, we can say, in a body, that sometimes urticaria can be very harmful as well. Doctor, we have discussed about the symptoms, the causes, what is urticaria, why it happened. What are the treatment options which are available for urticaria?
See, the mainstay of treatment is antihistamines. So, as I told you, histamine is the thing which is a substance which is released in the blood. So, that is causing all the symptoms. So, to make the symptoms to make the patient feel better, to reduce the itching and the rashes, antihistamines are the first line of treatment. Okay, antihistamines meaning something like you take for cold also, like cetirizine and cetirizine, levocetirizine, belast. These are many antihistamines that we use. That is the first line of treatment. And something to soothe the skin, calamine lotion is one thing all of us advise. And then when we look for the causes, like if there is an infection, if you find out that there is an infection, if the patient is having a cough and a cold or a caries, get it sorted out. Use a course of antibiotics. And gastritis is also one of the causes. So treat the gastritis if a patient has it. So try to find out the cause and treat that as well. This is the mainstay of treatment. And sometimes when it becomes chronic, using antihistamine shouldn't be just taken for 1 or 2 days and then stopped. After some days, these tablets stop working. So when you take the antihistamines, take it for the proper duration as suggested by your doctor. And then it usually, if it is an acute urticaria because of an acute episode, it comes down. But only when it is chronic, we'll have to investigate, and then we look at the total count. That is, if there is any infection in the body, or if there is any IgE levels which is increased. So then, if that is the case, we do other things.
Okay, that means there are treatment options which are available. So if somebody is having urticaria, do not self-medicate. There are treatment options which are available. Doctor, what would you suggest to the people who do not take the full treatment? They think that urticaria is gone and now I don't need to complete my full dose or full treatment.
See, it is not like a course of antibiotics that you have to take it for that many number of days or anything like that. But one thing is, you take it for for a particular. Usually, we give it for maybe 5 days or 10 days. You take the course so that the histamine, whichever is coursing in the body, comes down, and they don't get the bout of urticaria again. Okay, but when it is chronic, first we ask one thing. When the urticaria is chronic, it's been coming on and on. We ask patients to maintain a food diary if they can find out the cause of the urticaria. some items, some food items may be causing it. So maintaining a food diary and trying to note down when they are getting the urticaria, after eating what, and then checking it again, and then eliminating these foodstuffs will sometimes uh, be very helpful. But when the patient is not able to find the cause, there are other things that we do. We do a skin prick test, we do food allergy testing. So these are the other tests that we can do to find out the food allergy causes. And later on, if it has been like sometimes what happens is you take, even with the antihistamines, the itching doesn't come down. So then we look at other options. There are biologicals also which are available to treat urticaria. These are injections which are given 4 weeks apart. So they tend to get down the rashes.
Okay, so that means there are some lab tests which are needed if
Yes, yes.
it is not coming. So what kind of lab tests are needed and why? Is it like when somebody have chronic urticaria and the cause is unknown, that's why we do lab
Yes,
tests?
when we don't know the cause, and the patient, like you don't want to go on taking antihistamines all along, because antihistamines come with their own sort of side effects. Some of these medications are make the patients drowsy, so you don't want to take them for a long time. Okay, so at that point of time, if we can find out the cause, if it is, and there are one other thing that we do is autologous serum skin test for autoimmune urticaria. We separate out serum from the blood and inject it to the same patient to find out if they have autoimmune urticaria. This is called as ASST. If that is positive, we give the same serum as injections to the patient. This is one sort of treatment. And the next thing is we try to check the IgE levels. If they are elevated, we can treat them with biologicals. And if the IgE is normal, there are other drugs which are available which can be used for treatment.
So these are the various treatment options which are available if someone have acute or chronic urticaria. There are the treatment options which are available. Doctor, sometimes people also do not treat urticaria. And what are the potential complications of urticaria? If they not treat it, if they never go to a doctor and do not ignore the urticaria, and they just leave it like that only. So, what are the potential complications if the urticaria is left untreated?
Um, See, there are no chances that the patient will leave it untreated. It is such a condition wherein your itching doesn't subside if you don't take treatment. You'll have to do some sort of a treatment, even if it is a symptomatic treatment to reduce the itching. Anybody with urticaria will know to take a pop in an antihistamine when he has the symptoms. So, if left alone, it doesn't cause any complications as such. It's only that. Uh, the unbearable itching is there. So people can't live with it. So they will do something.
Right, doctor. And doctor, now we have live viewers question who are watching this live. So as we are discussing about urticaria, so there are some questions. There is a question that can hives appear in different shapes or sizes?
Yeah, there's no shape or size. It can be large hives or small hives. Yeah, definitely. And it can appear, any shape it can appear. It's nothing on the skin.
Okay, so it depends on the skin and the cause. The size may differ. Okay, doctor. Doctor, there is another question that what does it mean if hives are
Of any size. I didn't get you. Can you repeat the question, please?
Yes, doctor. Doctor, there is a question that what does it mean if hives are painful?
Painful. See, usually urticarial rashes, like when they come, they disappear within 24 hours. In an area, they don't stay for more than 24 hours. But if it stays for more than 24 hours and they are painful, it can be urticarial vasculitis. That is a whole different aspect okay, then it becomes a little, we'll definitely have to go on and investigate, look for ANA profile, that is anti-nuclear antibody profile. There's a whole set of other things. Okay, if it is painful and if it is going to be there for more than 24 hours at one site, this definitely has to be investigated for other causes.
So, as doctor suggested, please do investigate if your hives are painful. As she said, that it can be the another reason. Doctor, we were discussing about Urticaria hives. There's another question that, ma'am, can Urticaria occur without visible hives?
That was sometimes it can be just be itching, which is there all over the body. Not much of hives will be seen, but it is not very common like that, because the histamine will show it's the hives are it is seen most of the times. Like maybe it is small, not autoimmune urticaria. The hives are not big, very very tiny lesions. One here or one there, it can appear. So usually there are rashes.
Okay, so that means there are usually rashes. Someone have urticaria, rashes will be visible and then it may be disappear, as you already told us that sometimes they are visible and
Yeah,
the
you
other
come
time
in.
come in and go. Okay, okay, doctor. Doctor, there's a question that are there any ongoing clinical trials for urticaria?
Clinical trials, yeah. See, the biologicals are the newest drugs in the market. So right now we have one biological which is available, which is called as omalizumab. So there are trials, clinical trials, which are going on with many other biologicals. So definitely clinical trials, because chronic urticaria is a condition where we don't have a definite treatment. So definitely clinical trials are going on.
Okay, okay, doctor. And doctor, is it like that urticaria occurs in a specific age group? You know, as children go out more often, or youth, or above 60? Is it like that, or it has no age bar?
Anybody can get urticaria. Even usually in children, we see it with infection. They get a cough and a cold. Together with that, there are hives which appear also. Uh, Anybody at any age group, anyone can get urticaria.
Okay, and it is genetic as well. If someone in the family have urticaria, can it be transferred or
Not urticaria. Angioedema is genetic. Angioedema, it is like I told you, that swelling which appears with urticaria, that is angioedema, that can be hereditary. Usually urticaria is not hereditary, like it is not genetic.
Okay, okay, doctor. And here's another question from a live viewer that, doctor, how long do hives last?
That's what it usually lasts between 15 to 20 minutes. Sometimes it can go on for an hour or two. Okay, then it disappears in that area. Wherever it has appeared, it disappears. But definitely it can just come next to it also, the rashes can appear.
Come
Only,
again.
only thing we'll have to look for is, like, if the rash stays in a one particular point of time more than 24 hours, this is something which you have to definitely visit a doctor and tell that, yeah, this is what is happening. Then you will have to undergo certain investigations to see if it is not vasculitis. Vasculitis is inflammation around the blood vessels. If that is the case, the whole treatment and the treatment options and everything changes.
Okay, okay, doctor. And doctor, can urticaria can also be caused by stress? Are there any? Is there any term called stress urticaria, and is it look different?
The stress aggravates urticaria. As such, stress causing urticaria, mm, I haven't come across, but definitely any of the conditions, any of the skin conditions gets aggravated by stress.
Okay, that means it can be a small bit can be aggravated, as you said in
Yeah.
urticaria. Not a specific stress urticaria, but if someone have urticaria, it can be because sometimes people are stressed that they have urticaria,
Yeah,
and
that's what I was about to tell. See, having urticaria is only stressful. So that stress again aggravates urticaria. It's like that. It's a cycle like that.
Right, and people are more often, not going out because they have urticaria. So, what is your advice to the people if they have urticaria? What precaution they should take? Should they go out or not? Should they treat it or not? Any advice? Someone who is facing urticaria, what is your advice to them?
See, thing is, there are different options for treatment which are available. If some these what I told you, the biologicals are a little expensive, but if it is going to get your symptoms under control, your disease under control, we should definitely go for them, because there is a cure. Like the rashes, somehow or the other, we can get down the rashes, we can treat it, but you'll have to come and approach and learn about your disease, what can be done, what should not be done, what aggravates your urticaria.
Okay, right. Definitely, ma'am. And we are discussing about urticaria. We have Dr. Leena Ravindra with us, and she is telling about urticaria, the causes, how it can be cured, the various treatment of urticaria. And now will be, hello, doctor, can you hear me? Okay, am I audible now? Okay, so we are discussing about urticaria. We have discussed about the symptoms, the causes, how it can be treated, and Dr. Leena explained it very well that how if you have urticaria, you should go and visit to a nearby dermatologist and not self-medicate. Doctor, can you hear me?
Yeah, I can hear you now. Yes.
Yes, ma'am. So we were, I was telling that, how self-medication is not suggested by you, that, over-the-counter medications, over self-medication, home remedies. Sometimes, doctor, people also apply home remedies, some kind of oil or anything. Does it help in any form?
Whatever the thing is, the symptoms might reduce a little, like whatever the itching might reduce a little. Other than that, I don't think they'll be able to clear the condition until unless you know what is causing it and then eliminate that. See, there are so many of our urticarial patients, like who have had the disease for a long time, are quite depressed. Okay, and the thing is, like you'll have to explore other options which are available. So as soon as we tell biologicals, they're a little expensive, but definitely it is worthwhile to go and take those medications rather than it is the quality of life is also very important. So if you're healthy and your mind is good, you can achieve anything. So you should definitely spend on your health. So there are things which are available. Maybe a little on the expensive side. Not antihistamines doesn't cost anything. Like it's very cheap. But biologicals are a little expensive. But definitely they are worth the cost, and they can keep the urticaria under control in patients who don't have control over the rashes.
Very well said, doctor. That quality of life also matter, and if you are spending, do spend it on your health. Doctor, before we end this very informative session, any myths you have heard about urticaria and you want people to know that these are the myths and clear it?
The thing is, they as soon as anybody comes with urticaria, they have a list of things that they shouldn't be eating. Then this is what somebody told me not to eat. First among that comes brinjal. Don't eat brinjal, don't eat tomato, don't eat chilies, don't eat that, don't eat this. So it is not like that. And one thing is, don't eat non-veg. So it is not so. So it might not be for everybody. So it is very, very specific. We should know what it is. This is one of the biggest myth. Like anybody who comes with urticaria definitely mentions brinjal. It is not, brinjal is a good vegetable.
Okay, so is it not advisable that every vegetable or every food item may be allergic to one person?
Yes.
As you have told us about that when they go for treatment, you set a list of food items which you have eaten, and then you know that this is the particular item which may cause urticaria to them. So yes, a myth that do not eat this, do not eat this. It is not like that. Do not self-medicate and go to your nearby dermatologist so they know better that what is happening in your body. Doctor, any advice you would like to give to all our viewers who are watching this live?
As you have been telling, like, don't self-medicate. Dermatology is a field wherein everybody becomes doctors. When you have this, there is like how you apply that, this is going to go away. And we come across patients who they come with as I told you, like they come with a problem because of the medications that they have used. So this happens quite frequently, that they use something and something happens. So unless you know what you can apply, what you can't apply, please don't apply things on your skin. That would be my advice.
Okay, so don't apply anything which you don't know. And Dr. Leena has explained urticaria, its symptoms, clear all our myths as well, answered the question. Very, very, very informative session. Doctor, before we end this informative session, any takeaway message for everyone?
I didn't get you. Sorry, I was not able to hear you.
Okay, so any takeaway message for all our viewers and everyone who will watch?
Now, my message would be, take care of your skin. Skin is something which is, and everybody are worried about our skin, but skin health also means that you take your body right. Like you treat your body right. Eat healthy food, drink lots of water, and avoid sunlight.
Okay, so drink a lot of water. That is a very, very, very good takeaway message to take for everyone, that drink a lot of water. And in very, very, very informative sessions. Thank you so much, Dr. Leena Ravindra, for your valuable time. And it has been a very informative session for our viewers, and I am sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms which you have mentioned in this session, they know now that instead of self-medication, it's better to approach a nearby dermatologist. And it is really great to hear you, and we really look forward for many more such sessions in the coming time as well for our viewers, doctor.
Thank you.
Thank you. Thank you so much, Doctor. And thank you so much to all the viewers for your excellent participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all.